signed a supplemental budget that allocates $4.6 billion to continue state operations, give our state workers a well-deserved pay raise, and provide K-12 education relief funds. The legislature still has a lot yet to accomplish this session, but we look forward to the opportunities in front of us. Today, we're here to announce the new Acting Director of the Department of Health and Senior Services. We're excited to bring on a new leader for this new chapter at DHSS, especially as COVID has significantly declined here in Missouri. Since Omicron's peak in January, daily cases have decreased to less than 1,000 per day, down nearly 18,000. COVID hospitalizations has fallen from nearly 4,000 per day to approximately 1,300. The data shows the highly transmittable Omicron variant is falling just as quickly as it struck. Effective treatments are here and are working. And many people have some immunity to the virus because they have been vaccinated and have been previously infected or both. We are in a better place today than at any point since the pandemic started because we have more tools than ever before available to prevent serious illness from COVID-19 and have always taken a balanced approach. As we learn to live with COVID and prepare for what comes next to public health, our director is prepared, just as she has been on the front lines right here in Missouri. Throughout the pandemic, she is ready to tackle whatever challenges comes next. We're excited to announce Paula Nicholson as the new acting director of DHSS. Paula was a key player in Missouri's COVID-19 response efforts and has been a valued team member as DHS for more than 22 years. It is important to remember that DHSS is responsible for more than pandemic response, and Paula has vast department knowledge that will be invaluable as she takes the helm. Paula has held multiple leadership roles throughout her career, including maternal child care health director, chronic disease prevention director, emergency preparedness and response director, and she was involved in the state's H1N1 response as well as planning efforts following 9/11. Paula is not only a trusted voice within the department of her public health expertise, is respected by public health partners all across the state. She has put her career working closely with local public health agencies, hospitals, health association, and others to positively affect public health policy. Her work has truly made a difference in the lives of so many Missourians. And the knowledge she has obtained, skills she has acquired, and a relationship she has built will be a tremendous asset for DHS moving forward. We are excited to welcome Paula as DHS Acting Director and as the newest member of our cabinet. I will now turn it over to Paula for a few remarks. Paula, welcome aboard.
Thank you, Governor, and good afternoon. It is a great privilege to be asked to serve as the Acting Director of the Missouri Department of Health and Senior Services. It is a tremendous honor to serve Governor Parson, the department, our local public health, and other community partners. But I will tell you, the greatest honor for me is serving Missouri and my fellow Missouri citizens in this role. I have been with DHSS for over 22 years, serving in various capacities and at various levels of the department, from entry-level professional through senior-level management. We've all learned much during COVID response, and public health recognizes we will be continuing to learn from the research and the reviews of this response effort for decades. All public health interventions that seek to mitigate any disease or condition are best implemented as comprehensive strategies, a layering approach to mitigation. With regard to COVID, masks, vaccine, social distancing, and therapeutics all play a role. All are useful and should be available to each of us as we make personal choices about how best to safeguard our own health and the health of our family members in consultation with our personal physician. As acting director, I am committed to enhancing our collaborative work with our local public health partners, our healthcare and behavioral health partners, and all community partners. Areas of focus for the department will be addressing our public health and healthcare workforce issues, optimizing performance management and operational excellence tools to advance accountability, upgrading our data and surveillance systems, including the technology and the way we package that information for public use, and focusing our efforts on the leading causes of morbidity and mortality with an emphasis on health equity. I am a Missourian. I was born, raised, and educated in Missouri, as was my husband, our 3 children, and our 6 grandchildren. Our parents, our siblings, our nieces and nephews are born and raised in Missouri. So it's not just a professional privilege for me to be asked to serve in this role. It's personal to me. It's personal to me that Missouri's public health system functions and services our citizens optimally. It's personal to me that our public health, healthcare, and behavioral health systems integrate and function seamlessly together. It's personal to me that our healthcare facilities are appropriately surveyed and safe to provide care to our elderly and vulnerable populations. It's personal to me that Missouri actively works to decrease morbidity and mortality and enhance health equity across all public health and healthcare systems and across all age groups. It's personal to me that we actively examine our processes and systems and seek to do better every single day. Thank you.
All right, thank you, Paula. I didn't realize the 6 grandkids. So that is something we do have in common, I guess, to do that. So I know there's a lot of people in here today. Let me first just say, I know Lisa Cox is here also today, the Director of Health. They will be also working on a time frame where you can ask many more questions, that they'll set up that here in the next couple of days, if my understanding. Kelly will take, kind of acknowledge who's going to be asking questions today. There's a lot of you in here. I'll try to stay in here for a little while to answer questions for me or Paula. Either one of us are available for that. So Kelly, let's just kick it off right here.
You want to start with Paula?
Yeah, let's do that first. Let's ask the questions you want for Paula. Let's ask that. Keep in mind, you'll get more of a detailed briefing probably in a few days also on some of the questions you want to ask.
Paula? Take about 3 or 4 questions. Jack?
Just a couple. What is your hometown?
Fulton is our home.
And is that where you grew up?
Well, I've been there since I was 10, so I would say yes, yes.
And why did you want the job after what happened the last time?
Public health is a greater mission than any one human being. And while I had interactions with Director Karoff and found him to be qualified and professional, compassionate, certainly in the opportunity that arose afterwards, I was interested in assuring that our public health system did not falter, and we wanted to move forward quickly.
Much of the reason behind the last president and the previous director was based on conspiracy and misinformation. What do you believe the department's role is in countering that?
So I believe that government should be transparent. I believe public health should be transparent. So we will work very hard at communication strategies with all of our partners as well as with the public to assure that the public understands what's going on within public health.
Do you engage your guys' role in continue encouraging vaccination and countering disinformation that's propagated on social media?
So earlier I said any public health measure is best served as a comprehensive measure. And that's true with COVID as well. Vaccine plays a very important role, as do masks, as do social distancing, as do therapeutics. And it is an important role.
David?
I just want to clarify, what is your current title? What's your title right now?
My title right now is Deputy Department Director.
I will take one more for Paula. Emma?
We heard a lot over the past 2 years, it feels like, that public health is pretty much fighting everybody else. It feels like
So I think, none of us have experienced a pandemic before. And so I think none of us knew exactly what to expect in that and how that would modify relationships or cause periods of distrust or whatever. In that, as well, we were all learning throughout. And so as we had to pivot often, it caused periods of, is this the right information? Is this the best information? I will personally attest to you that we give you the very best information we have at any given time. It may change, but we're going to continue to give the very best information we can at any time, and we're going to continue to communicate openly.
All right, thank you, Paula. Governor? David?
Not really. We just want to get stability in the department. It's something that's been very important for us over the last 2 years. All of these people down below that director's position have been on the front lines for 2 years. And, as much stability as I can put in there. We weren't expecting what happened in the Senate with Don when he went up there, but it did. So we had to react to that and really just try to figure out how do we make sure that health department is still stable. I had the opportunity to work with Paula some when we were doing on the SEMA and how we fought COVID, and just wanted to put her in that position right now. And then I think she's the most qualified person right now to be in there.
Is your intent that she might remain on as the director indefinitely, like the firm director, or is this a...
Yeah, I hope so. From this day, we're looking at her as the director's position. When we did the one right after Don's, we had to do somebody temporary, and we picked the legal counsel over there simply because the legal side of it, just how we can make decisions and move forward on the legal front more than anything. But that was never intended to be a permanent position or acting director until we got a chance to appoint Paula. And we'll see where it goes. We'll see where it goes.
What does that mean as far as how far Paula can go as the director?
Yeah, go ahead, Emily.
I just wanted to ask if there's a national search going on, if there's anything else, or for now, this is what you're sticking with.
Let me kind of address that in a little bit of different issue. When we're talking about long-term searches, we know that situation, we're doing that. One thing we're also finding out, just the reality of the situation, I have 3 more years of being governor, so it's very difficult to recruit right now, to bring people into the cabinet when you're at that short of a term for them to expect them to move from out of state. We still look at that, but people look at our state too and says, hey, I want a little stability in our life. I just feel like Paula right now, I'm just a firm believer. Opportunity comes sometimes when you don't expect it, and I'm probably a little bit of a living example of that. And when you do, that calling comes, and I think for me it's about her being the director, and I look forward to her being in that position. I vision her as the director of public health today as I talk to you, is what I'll tell you. And I'm not looking for no one else.
Apologize.
No.
I didn't quite hear my earphones on. So what does this limit her powers as far as being acting director versus a permanent director?
No, she'll still be able to do the same things. We'll make sure. She'll be sworn in officially this afternoon. I think a little later in the afternoon she'll be sworn in, but she'll be doing everything the director would be doing. And again, I want to make it important. I look at her as the director, not so much the acting director. I look at her as a director. I look at her as being part of the cabinet at this point moving forward. That's the way I see it.
I don't want to miss your report this, so I want to understand what's happening here today. You are naming her acting director with the expectation she will at least serve out the remainder of your term as acting director. And by naming her as acting director, she is not subject to confirmation by the Missouri State Senate for that entire period. Am I correct?
That could be the possibility, but it could be she could be go through the confirmation hearing and everything. Right now, we'll see how that plays out. We may put her up there and get that confirmation in it months down the road, or next year we'll take a look. But right now, I think we just need the stability of a director to the Department of Health. I view her as a director, but yeah, she could technically be the acting director for my next 3 years. She could be, but.
That was not intentional on your part to avoid what you went through with Don.
No. We just got to get somebody in place. And again, I'm just telling you, whether it's Department of Health or whether some of the other ones, it is difficult to recruit somebody right now. It's just a pretty temporary position, and especially if you've got to talk about somebody's got to move their family and got to uproot to come in here. So it's a challenge. But, we're plenty happy with Paula where she's at, whatever the title is. I'm not so much hung up on titles anymore myself on that.
Have you spoken with Senate leadership about this decision to make it acting director? Have you heard back from them on the fact that they're not going to have input
No, you know what, I don't know that it's, you know, I'm not sure where that comes from, but I'm not sure it's necessary for the governor to go out and ask the Senate for their permission for me to appoint a director. I think it's their job to confirm the director, and they have that choice to make. But I don't think the process of who we select for the cabinet is part of the duties of the Senate. That's the duty of the governor's office to be able to do that.
We've got time for one more.
So you're
Jack?
not expecting the Senate to confirm your nominee this legislative session?
You know what? I haven't got to that point yet. I don't know why they wouldn't, but I don't know. You know, I mean, there's a lot of things on the table out here right now. And I'm with Paula there. I think that satisfies the idea that with the Department of Health is in stable hands and stable position. We got a lot more issues out there we got to be dealing with besides just this one. So we got to do a balanced approach and do all these things. So thanks everybody for being in here today.